From the beautiful beaches of Puerto Plata in Dominican Republic to the frozen tundra of New Hampshire. What a difference a week makes. Well, since I'm stuck here in the snowy New Hampshire while my family's skiing, and by the way, don't tell anyone, I'm really terrible at skiing. I figured I'll probably respond to a question regarding my previous video on efficiency. The question was about quality work and how it relates to our journey in dental school. In that video, I mentioned that we primarily learn about the disease and process-based outcomes in dental school and postdoc programs. I said that although managing disease through those processes is important, I believe that patient-based outcomes are far more important determinants of success, especially in a private practice setting, where focusing on patient satisfaction, overall satisfaction becomes the actual measure of success rather than a clinician's personal measure of satisfaction from their clinical radiographic results. So creating a warm, comfortable atmosphere for patients, understanding their anxieties while providing care with empathy and care and consideration is essentially what makes a clinician effective. Now, this may be a challenging concept for those of us that are introverts. Let's face it, integrating our patients' clinical and emotional management while maintaining a good bedside manner to achieve clinical success is a worthy goal. So I wanted to add another point to this concept from the perspective of dental school training. You see, when we graduate from dental school, we are at the competency level, which is the minimum standard of care, and anything below that would be negligence. However, our goal should not be to remain at this level. Within 3 to 5 years of practicing full-time after graduation, we should really aim to move beyond competency to proficiency. And proficiency is marked by honing our clinical skills and becoming confident in managing more complex cases. Once we gain enough clinical skills and confidence in our own abilities, we can then begin to shift our focus from managing our own anxieties about clinical practice and managing specific clinical procedures that are difficult into managing our patients' emotional state, their anxieties, and their overall experience under our care. This transformation requires repeated, deliberate practice, patience, and a constant desire for improvement. Personally, I found that I learned more meaningful information and skills about my field and patient care after leaving dental school than I did during my whole schooling. Ultimately, if we consistently engage in deliberate practice, maintain conscientiousness, and adopt a mindset of perpetual improvement, what the Japanese refer to as kaizen, we can then move from proficiency into the next and the highest level of practice, excellence. Excellence in dental practice goes beyond producing beautiful x-rays. It involves mastering clinical procedures, patient management, staff and referral base, and even building broader personal and professional community relationships. Ultimately, it's about leading your community. At the pinnacle of excellence, the clinician becomes a philosopher in his or her own field, continuously honing the craft while creating value and progressing the field, pushing it forward. That's when we see beyond our own needs and interests and we begin to give back to our community. So the journey begins with attaining competency in dental school and then progressing to proficiency and mastery through deliberate practice and conscientiousness. The final destination is reaching wisdom in the field, where holistic understanding and wise creativity crafts progress. See, mastery is not a simple achievement. It requires a constant effort. While we all fall short of perfection of any of these levels, the journey itself is worth the effort. Aspire to be the best you can be, constantly honing your skill and striving for excellence. All right, it's getting late at night. I'm heading back home. Have a nice warm drink, and I'll be drinking to all you aspiring master clinicians, continuously growing and striving to be the best version of yourselves.